Okay. All right. Do you give verbal permission to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University, class N495?
Yes.
This assessment is intended to show my skills with the assessment actions only and is not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Okay. Okay, so I come in the room. Hello, my name is George. I'm going to be your nurse today.
Hello.
And I'm going to do your head to toe assessment. So I'm going to wash my hands in front of you. Can you please tell me your full name?
My name is Gina Cisnero.
Can you spell your last name?
Sisnero.
What is your date of birth?
November 26, 1957.
Okay, and who is the president?
Donald Trump.
Okay. All right, so we're going to get your vital signs first. So get your temperature, thermometer is underneath your tongue, and you close your mouth. So your temperature is 98.5, which is good. So we're gonna do your respirations next. So you do one full breath and one exhale. That is one respiration. So just breathe normally, and we'll time it for a minute. Great, so you have 18 respirations, which is normal. So now let's test your pulses, and we're gonna do your radial pulses. Okay, so for 1 minute, we assess your pulse rate, and for a minute, you're at 76 beats per minute. Perfect. So now let's do your blood pressure. So we put the cuff on, and then I feel your brachial pulse, and I keep pumping until I don't feel your pulse any longer. Then I put my stethoscope on with the diaphragm, and then slowly undial. And then the first loud noise that I hear is your systolic, and the last faint sound that I hear will be your diastolic. Can you please tell me your pain level from 1 to 10?
0.
Good. Okay, so let's now assess your head. So I don't see any lice, there's no abnormal tenderness, no protrudings, no open areas. All right, so let's feel your temporal pulses. Normal. Feel your carotid pulses, those are normal. And now let's assess for TMJ. Open your mouth, close, open, close. Okay, so now let us feel your, we're gonna test your thyroid. So tilt, and then we're going to assess your thyroid. So it's non-tender, there's nothing protruding. I can feel your trachea. And we're going to move side to side, and that is also normal. Good. Okay, so now we are going to assess your ears, and then we'll do your eyes next. Okay, so with my spectrum, I'm going to look at your ears. I see that your tympanic membrane is nice and shiny, the cilia hairs are good, your tragus is mobile and it's non-tender. The same side, same thing. Tragus is mobile, it's non-tender, and your tympanic membrane is nice and shiny, and the cilia hairs are in place. So now we're going to look at your nose, your mouth, and then your eyes. So your nose, with my otoscope, I'm going to see that your turbinate is symmetrical, it's midline. You don't have any open areas, no abnormal coloring in your nose. Take a deep breath. Take a deep breath. So there's no foreign objects making you not able to breathe. So open your mouth, and with my lights, I can see that you don't have any open lesions, no white patches, no abnormal redness. So we're gonna test your so say ah. Okay, so that is your glossopharyngeal. Now we're gonna look at your eyes. So with your, can you please help me with my light here? Okay. So now we're gonna look at your eyes. So let's do your corneal reflex, your twinkle. So I see that the light is reflecting off your pupils, which is normal. So now let's do the confrontation test. The confrontation test. So I need you to close your right eye, which I will do as well. And I want you to tell me how many fingers am I holding out without looking at my fingers because we're testing for your peripheral vision.
2, 2,
Okay, we'll do the other eye.
2, 2.
Good. So now let's also test for the 6 EOMs, which is the 6 facial gaze. So without moving your head, I just want you to follow my instrument with your eyes. Okay, so now we're going to test for Perla. Make sure that your pupils are equal, round, reactive to light, and accommodating. Good, they're reactive to light, consensual. Good. Okay, so now accommodation. I need you to look at my finger and then pick a point on the wall. So now look at my finger, look at the point on the wall, look at my finger, and the point of the wall. So we're making sure that your eyes are dilating appropriately when you look at my finger, and then transfer your sight to the point on the wall. Okay, so now let's check for your trigeminal nerve. So we're gonna go back to your temporal muscles, and I want you to smile, and then I want you to open up your jaw, close, open up it, and then go side to side with your jaw. Good. So now let's do your hypoglossal nerve. If you can say light, bright, and dynamite.
Light, bright, and dynamite.
Okay, and then the next nerve is facial symmetry. So smile, frown. I want you to raise your eyebrows, and everything's symmetrical. Great. So now we need to listen to your lungs, and then we'll listen to your heart, and then listen to your abdomen. So we're going to turn around. Okay. Okay. So we're going to listen to it's a 6-point assessment with your lungs. Take a deep breath. Good. So now we're going to test for consolidation with percussion. Good, so I heard resonance, which is normal, and then now we're going to test for tactile fremitus. So once you feel my hand on your skin, I need you to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great, so when I was testing there, I felt the vibration on your upper portion of your lungs, which is normal, but I didn't feel the vibration in the bases of your lungs, which is normal. So now we're just going to palpate to make sure that there's nothing abnormal, nothing protruding, nothing that's tender or abnormally tender. So we're good there. Let's turn around. We're going to listen to your lungs in 2 spots in the front. Take a deep breath. Good, and so now we are going to listen to your hearts. Let's also test for your skin turgor. Good, and then your cap refills, less than 3 seconds, perfect. Okay, so now we're going to listen to your heart. Okay, so we're going to listen to your aortic, pulmonic, tricuspid, and mitral. So listening to your aortic and your pulmonic, we're going to use the diaphragm because they're S1, S2 sounds, and if we were to listen for S3, S4 sounds, which are abnormal, we would use the bell. So we're going to listen to the aortic, which is located on the right intercostal space. Now we're going to listen to your pulmonic, which is located on the left intercostal space. Then your tricuspid is going to be listening to your, it's located, so we listen to it on your 4th intercostal space. And then your mitral is going to be located in the 5th intercostal space. So everything sounds good. So now let's test for your reflexes. So for the brachioradial reflexes, Okay, so now we're gonna do over here for your reflexes. Good. Good. All right, so I need you to, we're gonna test for your cerebellar. So what we're gonna do is do fast movement. So we're gonna go down and up and down and up, like that. Good, and then we're gonna do this. Like one, like that, and like that. Good. So we're gonna do the Romberg test, which we're gonna put our hands like this and hold it for 30 seconds. Okay, so 30 seconds has passed and you didn't fall, which is good. So now we're gonna do it again, but close our eyes for 30 seconds. Okay, so 30 seconds has passed again and you did not fall. I just wanna inspect your skin as well. So your skin is warm to touch, it's no abnormal colors, but I do recognize that you have edema on your feet. And your lower legs has edema as well. So there's a little bit of edema there, but there's not edema anywhere else. So we're also going to do, we're gonna test for your balance. So we're gonna go walk barefooted, heel to toe. Okay, good. So let's also again come back this way and feel your pulses. Radials are good, and then we're gonna also feel your pedal pulses and your dorsalis are over this way. Good, so let's lastly listen to your abdomen. So we listen to your abdomen for a minute in each quadrant. Okay, so a minute's passed, a minute's passed, 1 minute has passed, and 1 minute has passed. So it sounds like your bowel sounds are normal and they are not hypotonic or hypertonic. So they sound good. When was your last bowel movement?
This morning.
Good. So do you usually go every day?
Mm-hmm.
Good. All right. So that is our head to toe assessment. Thank you so much.
You're welcome.